talking about sudden cardiac death, guidelines, warning signs, or prevention, I want to start a story, a true story, and probably the story that it changed the way I personally think about sudden cardiac death awareness. It started very simply. About 4 or 5 years ago, a nurse who works with me at my hospital sent me an ECG on WhatsApp. No history, no clinical details, just an ECG and a very simple question. Doctor, what do you think about this ECG? I looked at it. The QT interval was clearly prolonged. So I replied with one question. If the person who has this ECG had ever syncope, I need to see him. His answer surprised me. He said, actually, doctor, this ECG belongs to two children, not one person, a brother and a sister. And they had another brother and sister who both died. At that moment, everything changed. I need to see these children and I need to see their parents, I told to him. When I met the family and started asking questions, the story became much bigger than two abnormal ECGs. The two children who were still alive had congenital long QT syndrome and were considered at significant risk by risk calculators, by risk assessment, which is not topic today. They were referred to the National Heart Institute and eventually received ICDs. But what really stayed with me was the story of the two children they had already lost. Both had experienced episodes that looked like seizures. They had been admitted to intensive care. The problem had been diagnosed as neurological condition or CNS insult, and eventually both of them died. At that time, nobody knew that the heart could have been behind the story. Nobody had connected their seizure-like episodes with a possible cardiac arrhythmia. And nobody knows that was something much bigger hiding inside the family. So we started asking, not only about the children, we started asking about the entire family. And suddenly, a pattern began to appear. There had been multiple sudden deaths over many years, young people dying unexpectedly. And when I asked the family about it, their response was something I will never forget. They told me very simply, people in our family die young. That was how they understood it. It had happened for so many years that it had almost become part of the family story, not a disease, not a warning sign, not anything, just this is what happened in our family. And of course, we all believe in destiny. But believing in destiny doesn't mean that we should ignore a warning that may allow us to protect another life. As we went deeper into the family history, we found that many members of this extended family were related by consanguinity. So we started screening the family, ECGs, clinical assessment, family history. One person led us to another and another and another. We identified several affected or at-risk family members. Some required ICD implantation. Many were started on beta blocker therapy. And gradually, something that had been happening in this family for generations without an explanation finally had a name. More importantly, it became something we could act on. And this was the part that it changed something in me. I kept thinking about those two children who had died, and I kept asking myself, what if someone had connected the dot earlier? What if after the first unexplained seizure, someone had thought about the heart? What asked about the rest of the family? What if this family had known that unexplained fainting can be sometimes the cause of a dangerous heart rhythm, and a sudden unexplained death in young person should never simply end with that person? We can't say that every cardiac death can be prevented. It can't. And we can't go back and change what happened to those two children. But perhaps we can change what happens to the next family. That experience made me realize something very important. As physicians, we know these red flags. We know about inherited arrhythmia. We know about long QT, Brugada syndrome, CPVT, and inherited cardiomyopathy. But the family sitting at the home doesn't know these names. And actually, they don't need to. They need only to know something much simple. They need to know the warning signs. Fainting without a clear explanation deserve attention. Seizure without a clear explanation may sometimes come from heart. Unexplained palpitations, chest pain, dyspnea, especially with dizziness or fainting, should not be ignored. And most importantly, when a young person dies suddenly and unexpectedly, we must ask why. And we must ask who else in this family could be at risk. Since that family, I have spoken to many people about sudden cardiac death, different families, different backgrounds, some of them highly educated and very health aware, but I surprised by how often this message was still new to them. That when I realized that the gap is not only a medical gap, it is an awareness gap. And that is why this subject became very personal to me, because sometimes we don't need a new technology to save the next life. Sometimes we simply need someone to recognize the warning, to ask one more question, to look at the family, not only the patient, and to connect the dots. That first ECG came to me as a simple WhatsApp message, but behind that ECG, there was an entire family waiting to be discovered. And this is why we are here today. Because sudden cardiac death may be sudden, but the warning signs are not always silent. And if we learn to recognize them, one story of loss may become the reason another life is saved. And before I finish, I would like to share something very close to my heart. I put together this short awareness video with message I deeply believe in. Awareness can change the course of the story, and sometimes it can save a life.